Welcome back to the Pat and Aaron Show. Let's get right to our injury report brought to you by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And let's join back to the program Dr. Jeffrey Kannen. And Dr. Kannen, we got a lot to get to today because Baker Mayfield, he did practice yesterday and everything looks right, but it's pretty incredible with the ankle injury he's been dealing with the ribs. He played through the pain. He was successful. How do you think he was ready and able to play like that in that game dealing with all the injuries last week?
I mean, he looked great. The team did good. I'm sure he had a lot of help with his ankle. He was taped up really well. I didn't see him really flinch at all with his ribs, so it sounds like his pain levels are, manageable at this point. So overall, I think he's doing great. He practiced yesterday well, didn't have any issues. So I think moving forward, he's in good shape.
Yeah, there was no question on Monday night that he was throwing the ball differently. The prior week, he was 0 for 8 on balls that traveled more than 10 yards in the air, and you could just tell that the ribs and the way the ribs felt impacted him. I actually asked him after this last game how much easier it was for him to throw the football. Talk a little bit, Doctor, if you can, about what that recovery is like for the ribs. Why, first of all, it is a little bit more difficult to complete a throw when you've got some of that pain in your rib area, and then as you start to heal, why that becomes so much easier.
Yeah, ribs are tricky because every time that your body is shifting or rotating, you're going to feel that through your spine, and that connects to your rib cage. So, once the pain starts to get better, once those start healing, you're able to move better, you get more mobility, and you're able to, function much better.
Doctor, I want to get to 𝗙𝗪cie𝗂𝘁𝗵, who the Bucs are going to be playing against this weekend in Detroit. He hyperextended his knee in that final regular season game, and initially it looked like he may have torn his ACL. That was the fear initially, MCL. Some of those fears came into play here, but he ended up playing in the playoff game and helping his team on their way to victory. How do you think he was able to recover so quickly from what looked like it could have been a devastating injury?
Yeah, those can be tough. It's scary initially when it happens. I'm sure they did a very thorough evaluation of his knee and made sure that there's no significant damage present. And once he was able to get back on his feet and keep going, that's how he was able to keep playing. So thankfully there's no significant injury.
Yeah, we saw that brace that he wore. It was a big one, and obviously it's going to impact your mobility a lot when you're playing with a brace. But when it comes to making sure you don't re-injure a knee injury like that, or when it comes to stability, how much is that brace helping in that situation?
Yeah, the braces help prevent the rotation of the knee. It helps it from bending inward or outward. So if you did have like a minor sprain, usually those are involving the MCL, which is that ligament on the inside of the knee. The brace helps stabilize that, prevents it from rotating or pivoting so that they can able to function and, keep playing.
When I go to basketball courts, just random average Joes out there, and I see the dudes they've got like the sleeve on their leg. What's that? I mean, I think it looks awesome as hell, but what's that all about?
Yeah, the sleeves don't offer much support. It's really for compression. So if someone's had a little arthritis in the knee, or if they've had a prior knee injury, and they get some swelling in the knee, or they just want some comfort on the knee, that can provide that relief. In the terms of support or stability, it doesn't provide much.
I want to ask you about Matthew Stafford. Even though the Rams are out of the playoffs, he took a scary hit to the head, and then he returned to play against the Lions. A lot of times now, I think we're seeing guys that are trying to initially skirt away from showing they have concussion symptoms, maybe to hold their rib or hold another part of their body to show that that's, I don't know if they're that aware, if you can be that aware in a concussion, but what do you think happened there with Matthew Stafford, and why do you think they let him continue to play?
I mean, if you look at that video, it looks like his eyes roll back. He did have, a little bit of what we call flexion, posturing of his hand. But then he was able to get back and he was, up and out. They did evaluate him on the sideline. I'm sure they did a thorough exam. If there was any signs of lingering, focus, attention issues, if he was not able to recall things, they would definitely keep him out.
Doctor, we've all suffered an injury where in the moment, whether it's adrenaline or whatever it is, it doesn't bother us all that much. And then we wake up the next day and we're like, uh-oh, that hurts a lot more than it did yesterday. Do we ever see delayed symptoms like that with concussions, or is it always kind of pretty immediate after the impact of the hit?
You can have delayed symptoms, but generally you're going to have symptoms initially. I've rarely seen where you get delayed symptoms and you don't have anything initially. So it could be very, very mild initially. That's not picked up. But if you do a thorough exam, if you make sure that they, rest and then re-examine them again, sometimes you can pick up on these things initially.
Well, listen, Doctor, we hope that we get to talk to you soon because the season is nearing an end. But if we don't, we really appreciate everything you've done for the show. show this season. The Pat and Aaron Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute, providing you access to one of the top orthopedic programs in the nation. So if you are dealing with any injury, don't wait any longer. Schedule that appointment today at floridaortho.com. Thanks so much, Dr. Kannen.
Thanks, guys. Take care.
Thanks, Doc.